Hi everybody, I am making this video today to talk about something called, we call them surprise denials by insurance companies, and I use the air quotes because they're not a surprise to us, but they're often a surprise to patients. And obviously it can be a challenge because you can't talk to your insurance company directly. And so a lot of times doctors' offices kind of get stuck in the middle whenever a surprise denial occurs. So most doctors' offices, including ours, we will call your insurance company or check on the portal to find out, when your treatment is recommended by your doctor, there's certain codes that we use, and we will check those codes to find out what the coverage profile is. And when we do that, insurance companies will often say something's covered. And then after you have your treatment done and it processes, we actually sometimes find out that the insurance has denied it. Sometimes insurance companies will deny because they deem something, quote, not medically necessary. One of those common ones we see is a bone graft that a insurance company decides is not really necessary and therefore they will not cover it. So in that case, we thought it's covered at 50%. Sometimes we think it's covered at 100%. And we only find out after we get the explanation of benefits that your insurance company has denied it. Most often, offices will attempt to appeal at least once, and we do, but oftentimes are not successful with that, as it is an adverse determination made by your insurance carrier. A second reason that can happen is something that there's a waiting period. So if you have a new insurance policy, some insurance companies will make you wait 12 months before using it. And again, this is in the fine print of the insurance policy when you sign up, and most people don't take the time to read the whole thing. A third one is something called a missing tooth clause. So it's sort of the dental version of a pre-existing condition. So anything that, say that you had a tooth out and now you want to get insurance to cover the implant. Well, the insurance company will say under that particular plan that yes, the implant's covered at 50%. Wonderful. But again, in the fine print of your policy, it'll say, not if that tooth was already gone when you got this insurance. And so they'll deny the implant in that case. Other insurances, so I don't want to say any by name, but there's one carrier that we have which will not pay for a dental implant will not pay for a bone graft and a membrane until the implant is done. So what we often have to do is tell the patient, your membrane and graft, you're going to have to take care of that out of pocket. And then when we get your implant done, we'll send it all in for reimbursement and you'll get a refund. Because if you don't end up having the implant done, then the office isn't reimbursed. And so it's an issue. There are other insurance companies that will say, so sometimes I call it in an oral surgeon's office that you're caught in a gray area because the medical company will say, your medical insurance will say your dental is primary, your dental insurance will say your medical is primary. And so there's one particular carrier where I tell patients you'll expect 2 denials, one from your medical, one from your dental. And on the third one, we'll actually get reimbursed. And you can imagine all of this takes incredible amounts of, I call it woman power because all my staff happen to be women, but just the, hours that we spend, communicating with your insurance to get reimbursed can be quite challenging. Sometimes we see alternative benefit provisions, which are, where an insurance company will say, well, you have more than 2 missing teeth in that quadrant, so we actually will only pay what we would have paid for a partial, and we're not going to pay the difference. Those are some of the ones that we are seeing. We actually also see pediatric moderate sedations getting denied, saying that it's not medically necessary to sedate a child, which is sort of crazy to me. So the moral of the story is to realize that insurance companies don't exist for patient benefit as much as we'd all like to believe that that's true. There was a story I watched on 60 Minutes about some of the victims of the hurricanes that had, a total loss, but the adjusters had said, oh, we're going to pay for a total loss, and then when the claims processed would only get $20,000 or $30,000 for a leaky roof, which everybody knows if a roof is leaky, the house underneath is destroyed as well. So unfortunately, insurances are for profit. I think it's really important people understand that insurance companies are for profit. They are not fiduciarily obligated, which means they're not obligated to act in your best interest. So we, as the oral surgeon, try to do everything we can to make sure that we maximize your benefits, but we always ask patients to double check the codes that we give you, ask about these things, missing tooth clauses, waiting periods, alternative benefits, if something's medically necessary or not, so that you're as informed as possible prior to having an adverse determination on a claim. But I just want you to know we're always trying our best to inform patients of these things because we don't like surprises unless they're good surprises.